Okay, everyone, we're about to get started with this next panel. Wow, it is very, very crowded. This is so lovely. Okay, so good morning, everyone. I'm so happy that all of you are here. I'm Tiana Woodard. I'm a Black communities reporter with the Boston Globe. And importantly for today, I'm going to be your moderator for this next discussion on expanding drugstore deserts, or we like puns at the Globe, so drugstore deserts, a bitter pill to swallow. So this panel, this discussion is kind of an extension of some reporting that I was really lucky to be a part of last summer, last spring, that looked at when a drugstore closes, what is left behind or what are the ripple effects of that in the community. And through our reporting, we're able to find just some quick stats that since 2017, at least 26 drugstores have closed within the city of Boston. And when you expand that to statewide, around 200 drugstores have closed their doors. And we also kind of put together our own definition of pharmacy deserts using research and found that 15,000 Boston residents live in a pharmacy desert, which we qualified as where you have no pharmacies within a half-mile radius of you. And on top of that, you lack the car to make a trip outside of that. And I know that you guys are probably seeing day-to-day drugstore closures, whether it's Walgreens, CVS, and those numbers are as of middle 2024. So I'm sure that those numbers have grown. And as always, our stories are nothing without the people that's shaping them, the people that are on the ground, working with constituents, providing life-saving medications, the people that are using their institutional knowledge to respond to this crisis in real time. And so for this discussion, I'm really happy to be in conversation with three of these folks. First, we have Mike Wilson, who is the president of the Massachusetts Independent Pharmacists Association, and also is the owner of Crawford Drugstore Pharmacy in Dorchester Ave, so my old stomping ground. We also have Jessica Prince, who is the Chief Operating Officer of the Brockton Neighborhood Health Center, who is going to have some great insight into the pharmacy that they are working in there and how that's changed or impact their patients' lives. And last but not least, I'm going to try and not say Chris. I have a representative, Chris Worrell, who is the state rep for 5th Suffolk, who is representing a lot of the constituents who have seen their drugstores leave their communities behind, and is responding to the crisis with his lived experiences as a Boston native and also as a rep on Beacon Hill. So thank you three both for being here. I'm really excited to speak with you, and I know our audience is excited to learn from you as well. I have questions, but just as a reminder, you can scan the QR code on your lanyard and send in questions. I will try and get into as many of those as I can and integrate them into the conversation, but I'm just gonna get started. And Rep Worrell, I really wanted to start with you because I know that a lot of this reporting started when early 2024, when we saw these news alerts and all these calls about the Warren Street Walgreens in your district closing on MLK Day of all days. And so I guess, can you take like readers or, oh my gosh, this is not a paper, viewers back, our viewers or listeners back about what that time was like, what you were hearing on the ground, how your constituents were being impacted by that?
Amazing question. So even before then, there was a Walgreens, and I'm gonna call it Dudley because I'm old school Boston, but now Nubian Square closed down. And my brother's a Boston City Councilor, so while I was, getting familiar with the State House, he was already attacking why the Walgreens in Nubian Square was closing. Then, I'm just like, maybe bad business. I'm not really thinking because you have a whole new job you got to get acclimated to. Then it hit home. It hit home, meaning January 2nd, there was a notice put on the Walgreens door that said, we are closing on MLK Day. Out of all days, they picked MLK Day to close. Then started getting phone calls from the constituents. And I decided to walk around that Walgreens, and I seen this middle-aged woman just like moping around in the hall in the aisles, and I had the opportunity to talk to her, and what she told me really made me want to fight, to save all the all our pharmacies. What she told me was, she was like, Chris, this is the Walgreens. When I had when I was late, um, I knew they were closing, but I was late to pick up my son, so I had the option to pick up my son later, which is like $3 a minute when you're late when daycare, or pick up medication. So I told the pharmacist, "Hey, I'll be there tomorrow morning." But she knew that my child needed this medication. So she ended up picking up her child, going to her house, and like she said, 25 minutes later, the doorbell rings, and it's that pharmacist with the medication to give her son. And if you guys, anyone from Dorchester, um, Dorchester is love. Roxbury is love. This is what, pharmacies, it's more than pharmacies. The pharmacists is our, like, our cousins, our aunties, and so on. So when I heard that, I knew we already had a problem, but now it became a bigger problem. So with that, we started fighting. We called Walgreens, said, "You can't close." I said, "Rep, you can't tell me we can't close." I said, "So, well, just don't do it on Martin Luther King Day." They was like, all right, we'll wait till I think it was like January 31st. Then they ended up closing. But, um, you know, I'll stop there. But the fight still continues on.
Absolutely. And kind of turning to Mike, I know um, what really resonated with me is that like these communities, they're really rooted in love and care. And I know that you have been like an independent pharmacist in one of these communities for so long. And so I guess like just to start off, like, can you tell the audience about like more about your business and also some of the barriers or causes of why like we're seeing so many drugstores close their doors?
Yeah, absolutely. As a third generation pharmacy owner, starting with my grandfather, my uncle and I now run the day to day operations at our pharmacy. Uh, the story that Rep. Worrell just told about the pharmacist who took that medication to that woman's home after work, that's things that we do every day with our drivers and our technicians. We service a lot of senior housing buildings. We service a lot of group homes for people that are mentally unstable or otherwise physically unable to take care of themselves. We service our regular community members that either walk into our store or we deliver to their homes when they no longer are able to get out and about on their own. It's unfortunate that the economic landscape of the inner city pharmacies has kind of become what it is today. As an inner city pharmacy, 80% of our business comes from Medicare and or Medicaid. And unfortunately, we have these pharmacy benefit managers who are now kind of in between the payer, which in our case mostly is the taxpayer because that's how all these programs are funded, and us as the service provider. So you have this middleman who in some cases is owned by another pharmacy chain, or in other cases they have their own mail order pharmacies that they just want to push as many prescriptions through as a number on a spreadsheet, and you really lose taking care of the person and the patient and the family in those scenarios. um, Unfortunately, our state Medicaid office, up until this year, they finally have made some policy changes, hadn't really been regulating those entities and payments. So you would have patients moved off of Mass Health Standard onto these ACO, MCO plans who claim to be very focused on equity. And that may be true on the medical side, but on the pharmacy side, they really destroyed the pharmacy ecosystem in cities like Boston, Worcester, Lawrence, just our inner cities with very diverse populations, because they force these take it or leave it contracts on you with their PBM partners that pay us either less than our cost to acquire the medication or less than our cost to actually pay the labor to fill a prescription. I mean, I fill prescriptions still every day, less than $1 total reimbursement. I mean, how do you buy a medication, pay a pharmacy technician, pay a pharmacist, keep the lights on? So we definitely do need more regulation and more oversight in those areas. And until that happens, these trends are going to continue. Rite Aid was the canary in the mine. They're now defunct. Walgreens is, following the same path. And, it's something we've been talking about for years. I will give the Medicaid office credit. This year, they finally stepped in and have started to make some changes that make it more sustainable. But we also need changes in the Medicare program on the federal level as well.
Yeah, and I know like just with the title of this panel and what we're talking about, it is like seems very gloomy, but I also like kind of want to lift up some of these like community institutions that are responding and that are kind of handling or responding to this crisis in real time. That's why I kind of turned to you, Jessica, because I know that you guys have had some success in Brockton with the pharmacy. Like, can you tell like the audience here a little bit more about kind of what spurred the introduction of that pharmacy and what impact it's had on patients there?
Yeah, sure. So we started, the Brockton Neighborhood Health Center started talking about opening our own pharmacy probably 3 to 4 years ago. With 340B and the increased manufacturer restrictions, it was just becoming obvious that we needed to be our own entity. So we had a CVS in the building that happily departed. And we opened a pharmacy 2 years ago. It's been great for our providers and great for our patients. We do deliver. So we have 4 cars that drive around Brockton all day, making sure the patients get their medications. We were also fortunate enough that our pharmacy uses the same system that our providers use. So our providers can see, oh, you picked up this medication or you haven't picked up this medication, and start that refill for them while they're in the visit. By the time they're done with their visit with their provider, they can just pick up the prescription from the pharmacy. It's been really great to have integrated pharmacists too within the team. We can just send them a message, hey, got a question about this drug interaction, or how can we help with pill burden for the patients? Is there a way we can combine these 2 medications? Been very helpful for our HIV patients, make sure that they're getting their medications on a regular basis and there's no lapse there for them either. And overall, the pharmacy staff are just very mission driven. I don't know if they have that luxury when they work for CVS to really enjoy their work. And our pharmacists will tell you in our pharmacy techs that they really enjoy their work and they feel like they're giving back to the community. So.
And just to make sure, I know since I was kind of buried in the pharmacy landscape for like a long time, like I know what 340B is, but just to make sure, like in case someone may not know, like what is the 340B program and how does that integrate with the work you guys do there?
Sure. So 340B is a federal program that we're a covered entity. So we're a health safety net provider, and we're able to purchase medications at a discounted rate. And then we can utilize that revenue to then reinvest back into our patient care. That is a program that right now the current administration's looking at changing who oversees it, possibly to CMS, and then also looking at possibly turning it into a rebate program, which would be very hard for community health centers to do it that way, because we'd have to pay the full cost of the medication up front. And we don't exactly have tons of cash. So, and then we'd have to wait for the rebate to come in. And then the personnel with tracking that and making sure we're getting those rebates would also be challenging. So hoping that we don't move into that direction. It's definitely a lifesaver for some health centers to keep their doors open. 340B, it's a huge benefit financially for us. So,
did you want to add something?
Just to add some perspective on that, so the average HIV medication therapy for one of these patients is probably about $4,000 a month. So if you have a health center with 100 patients who need HIV medication, that
400.
Do the math. That's $500,000 that you're now fronting, waiting for money to come back, and that's a huge number for a small health center.
And especially with this federal government, you might be waiting forever.
I'm glad that you kind of segued into my next question. Just kind of the elephant in the room. I guess this is a question for all of you guys. Whoever wants to go first, but or how do you feel that the Trump administration will in fact affect drugstore deserts? Will they expand? Is there anything that's happening or that has that he's made announcements for that is particularly concerning or maybe exciting? I don't know, but probably concerning. Yeah.
Sure, so I could start. Um, so tariffs are unknown how that's going to affect medications. That could be a real issue. In all of the different tariff talks, I know things change daily, and there's a lot of what would we call them, carve-outs that maybe get, not included, things that do get lumped in. So that could be a problem because a lot of medications are sourced from other countries or the raw ingredients are sourced. There's talks of Medicare negotiated rates for certain medications, which similar to the 340B issue, we as a community pharmacy, we'd be paying the full amount up front and then waiting to get reimbursed from each manufacturer. And there's dozens of different manufacturers. So now you're trying to manage your reimbursements or your rebates coming back to you for things that you've already dispensed, 4, 6, 8, 12 weeks previous. In general, I will say PBM reform has been bipartisan. There's a lot of support from both sides of the aisle, so that is a promising thing that hopefully that can get done this year. And just, removing some of the complication and waste in the system. But there are a lot of unknowns with the constantly changing landscape.
Hit it on the nail. And also just by the rebates alone, I think it will kill independent pharmacies, just waiting on that money and knowing the unknown. Any day, like, who could front $500,000 for a certain amount of patients? Then you have 200,000 over here, 300,000 over here. So that all equals $1 million. Then you are just waiting. You don't have, plus you still got to pay lights, gas, employees, and so on. So just knowing the unknown.
Yeah, and I think just to add to that, potential Medicaid cuts, we don't really know. Who is going to get kicked off of certain plans? Are they going to be able to afford a plan? And are people then just going to go without what they need to treat their diabetes or hypertension or whatever their chronic disease management might be? It's, for me, I feel like it's a huge step back from all the progress that we've made.
Kind of going locally, I know Rep. Worrell.
I think you like picking on me.
No, but you've had great answers. That's why I'm beckoning you more. This is great. I just wanted to kind of like give you space to kind of speak about the work that you did in Beacon Hill last year relating to this. What can you speak more about some of the legislation that was introduced and pushed, and then even for you or for anyone on stage, are there specific legislation or recommendations that we should keep an eye on that people should maybe reach out and for their legislators and rally behind that?
So one thing that, I don't call it luck, I call it a blessing, is when all this pharmacy desert stuff was going on, the legislator decided to do a big pharma bill, looking at drug cost and everything. I filed an amendment. The amendment was really looking at pharmacy deserts in Massachusetts. It's an acronym. I'll get to the acronym later. But what it's done was in the amendment was a mandatory 90-day notice to the Board of Registration in Pharmacy Commission, local legislation letting the legislators know, the municipalities know that you're closing. Then, going to the commission and the commission seeing if your closure is going to create a pharmacy desert. We put that in. It passed in the House. But there's a but. Your state senators did not pass it in the Senate. So whenever you see a state senator let them know, why didn't you pass that pharma amendment? But this year we do have another bill. It is H 1419. And it's basically the same thing. We're going to try to get this through the House again. And I have a strong ally in Senator Lydia Edwards, who has it on the Senate side. So we feel very confident that this is going to pass. And this is going to, give notice instead of on January 2nd, putting up a little sign saying you're closed on Martin Luther King Day. Give notice and letting everyone know, and it strikes going to the commission, and the commission looking at, is this going to create a pharmacy desert? How can we, everyone put their minds together and, make sure something else, or how can we stop or slow down the process? So talk to your senators, because the House got it.
So another legislative solution that many other states have already enacted or are in the process of putting in place that we're pushing for Massachusetts to do is remove the management of the prescription benefit from these ACO and MCO plans because they've done such a bad job. Return it back to fee for service. Massachusetts already has the systems in place to do that. That's how the prescription benefit was run previous to 7 years ago when all these ACO plans started to pop up. It eliminates middlemen, it eliminates waste in the system, it pays providers directly a fair and reasonable dispensing fee, and it allows pharmacies to offer all of the services that our people need, especially now in the city. It costs money to deliver prescriptions, it costs money to package prescriptions for our patients. So, a fair and reasonable dispensing fee just makes a lot of sense, and taking that responsibility away from the entities that have failed in that area just is kind of common sense at this point.
Anything to add?
No.
Okay. I'm looking at the iPad. I see that there's one question. Do you guys have any other questions? I don't want to take up all the space, but it's a great question of kind of more about what can the community do to advocate against a lot of these closures taking place in these communities. I know they mentioned Roxbury, Dorchester, Mattapan, but I'm sure that extends to Brockton. A lot of these communities that are literally left high and dry when each store closes.
I mean, I would say to speak to our representatives to see what more we can do.
Don't speak to me, because you're speaking to the choir. I already know.
Yeah, and I think advocacy, as much as we can advocate for ourselves and our communities to make sure we have access to what we need to maintain our health, is imperative to stopping this from happening. And I think reform obviously is needed. So one thing I think is too is that pharmacists, they're professionals. They are not robots. And they go to school for 6 years. They have doctorate degrees, and they are part of the healthcare team. And we really need to treat them like that. And I think that some of these chain drugstores don't necessarily do that all the time. They have unrealistic, in my opinion, fill rates to staffing ratios. And I don't know if you guys have been into your local CVS or Walgreens, but I always have a lot of sympathy for those pharmacists there too, because they burn out too. So
Advocacy is one of the realest things, and letting not only your state rep know, but state reps know, period. I was on the healthcare finance committee last session, and we were talking about this. And one of my colleagues, his name is Kip Diggs, he has a cape in the islands. And when I was talking about pharmacy deserts and how they're closing pharmacies, these big pharmacies in my district, he looked at me, he was like, they just opened 3 in mine. So just not knowing, because everyone lives in their community, everyone lives in their bubble. So shedding light to state reps that might not know, state senators that might not know what's going on in Massachusetts, like what's going on in Dorchester and Roxbury, what's going on in Brockton, what's going on in your neighborhoods, and if you just care about it. If you care about people, just talk to your state rep, talk to your senator, and let them know, hey, I went to Santa Fe. I seen a good-looking black man come and talk about pharmacy deserts, and he was talking good stuff. And we need to do something. You got to sign on to the bill, H 1419, and then they'll probably reach out to me and we'll have that conversation. But we need you. We need you because we can't be in every four corners of the Commonwealth. So we need to hear the voices of the people.
And we've gotten the same feedback from our professional organization. Phone calls to offices do matter, and they do make a difference. So call, state level, federal level, everybody that you can.
I'm still laughing at you. You're gonna cost me my job. I see that really bright. I see 0000, so I know that time is up. I was gonna ask this question about like what keeps you moving, but I think just the takeaway I have from this is that even if your drugstore isn't closed, that doesn't mean that it won't eventually. And really, like, do not operate in silos. This is a network. This is an ecosystem that affects everyone. And really do what you can. Speak to your reps or maybe just the senators. But like, there is power, and power is in numbers. And so thank you. Yeah.
And I just want to thank Tiana Woodard from the Boston Globe. Woodard from the Boston Globe. Because when this was going on in my neighborhood, she was the first person to give me a call and say, hey, rep. She didn't call me rep. She calls me Chris because we have a great relationship. Hey, Chris, what's going on? Then from there, I've seen her at the press conferences. I've seen her always following up on this and writing in the Globe to, share with the whole Commonwealth and, the world what's going on right in our city. So I want to thank you for putting pen to paper and showing the disparities in our communities, especially when it's a big pill to swallow.
Thank you so much. I have no words. I usually have a lot of words to write, but I'm speechless. Thank you so much. Thank you three so much for taking time out of your busy schedules to share your perspectives, teach us. I'm very grateful. I know they all are too. And I hope you have all like a call to action to take away from this.
Thanks, everybody.
Thank you.